have another bill to sign today. Since we had you all here, since you were handy, Senate Bill 134, the Hospital Payment Assistance Program. I want to thank and recognize Senator Aguilar and Representative Avery. I want to thank the Colorado Consumer Health Initiative, the Colorado Center on Law and Policy, the Colorado Hospital Association, their members. This really was a broad-based coalition. The bill helps working families who do not have insurance to be able to pay their hospital bills responsibly. We know that medical bills, this is not widely known, but medical bills are 60% of all bankruptcies in the state of Colorado. So if you step back and look at that, one way to keep people solid and in the system is to make sure that we get them that support. I guess that's a national number, but Colorado's not far off of that. Bipartisan solution here that, between making sure that we have the collaboration of consumers and their advocates, providers, hospitals, and the legislature, we find a way that, brings some reason to the system. The legislation limits the amount that low-income uninsured patients would be required to pay on a hospital bill. It would be the same rate insurance companies pay. In essence, what they're really doing is what we're doing is increasing transparency, making sure everybody gets to see who's paying what. Certainly, I don't think it's the sole solution of high healthcare costs, but it provides real relief for vulnerable Coloradans who are facing excessive medical debt, and in many cases are, again, forced into bankruptcy. So now I'm going to turn this over to Senator Aguilar and Representative Avery, and then after the legislators, Bob Ladenberger, the President and CEO of Exemplar Healthcare, and Stuart Doherty will give brief remarks as well, and then we'll sign the bill. So, Senator Aguilar.
Thank you, Governor. Representative Grant. Thank you so much for coming. As some of you know, prior to coming to the Senate, have worked as a primary care physician for Denver Health and Hospitals for the last 22 years. And in one of my travels, I ran into a paramedic who told me the story of a gentleman who he really thought was having an acute myocardial infarction or heart attack. And the gentleman absolutely refused transport to the hospital. And what he said was, I almost own my home and I have some savings, and if I'm going to die, I don't want to leave my family bankrupt. And as a primary care physician, it really broke my heart to hear that story, and I was excited to work with our hospitals who are happy to have full transparency around their discount programs for the uninsured. As many of you know, Colorado has approximately 830,000 of our 5 million people without health insurance. And in addition, we're willing to say that they would not charge people who are under 250% of federal poverty level, or about $58,000 for a family of 4. They would not charge them any more than their best negotiated rate. And so I'm very excited to have the governor here today helping Representative King and I bring these benefits forward to Coloradans.
As a former chairman of the board of one of the largest neuroscience centers in the Rocky Mountains and on the board of other hospitals, I can tell you this bill has far-reaching implications for the first effort in transparent pricing to make sure that all of our hospitals are on a level playing field, that our patients who are uninsured or underinsured know they can go to any hospital in Colorado and get the care they need without the fear of bankruptcy over their extraordinary bills. This also will help us compete for pricing and look to see what we're being charged. So this has a huge impact on, I think, cost containment in Colorado and protects our consumers.
I'd like to introduce now Mr. Bob Ladenberger, who's the President and CEO of Exemplar Hospitals.
Thank you very much. I am Bob Ladenberger. I serve as President and CEO of Exemplar Healthcare and the Executive VP of the SEL Health System. And I'm also a past chair of the Colorado Hospital Association, and I'm here kind of serving all of those roles today. The Hospital Association represents 95 member hospitals and health systems statewide. I would like to also thank Governor Hickenlooper, Senator Aguilar, and Representative Avery for the opportunity to offer some remarks on the hospital payment assistance program. And I'd also like to thank the many individuals and organizations who collaborated to create this important piece of legislation. Colorado hospitals have a deep commitment to providing compassionate, quality care services to patients, regardless of their ability to pay. In fact, hospitals in Colorado annually provide more than $1.5 million in uncompensated and charity care to patients who need financial assistance and support. In 2011, the SCL health system contributed more than $220 million in community benefits, and an increase of $20 million over the prior year. That works out to more than $600,000 per day system-wide. One of our facilities, St. Mary's Hospital in Grand Junction, provided more than $40 million in charity care last year alone. Several years ago, the Colorado Hospital Association Board of Trustees adopted a policy on charity care that mirrors many of the provisions in the hospital payment assistance program. That's why we believe that this legislation will help ensure appropriate communication between patients and hospitals regarding healthcare services and associated financial responsibilities. The bottom line is this: hospitals want all qualifying patients to know about the charity care and payment options that are available to them. We are not a one-size-fits-all state when it comes to health care, and thus there is rarely a one-size-fits-all path forward. The elected officials standing with me here today recognized this early on. They work to ensure that this legislation allows hospitals to maintain charity care policies that reflect the unique needs of the communities and people they serve. And since organizations like SCL Health System and Hopsital Healthcare have long believed in the importance of charitable care and services for the community, I am especially proud that this legislation permits hospitals to maintain charity care policies consistent with the mission and the values of each organization. Senator Aguilar and Representative Avery showed exemplary leadership in convening the stakeholders throughout the legislative process, and they worked tirelessly to find common ground on this important issue. There was extraordinary cooperation and communication from start to finish, and it has resulted in valuable and beneficial enhancements for patients in Colorado hospitals. So on behalf of the SCL Health System, Hopsital Healthcare, and the Colorado Hospital Association, thank you for your efforts and congratulations on this important program. And I would like to introduce Sheila Doherty, who is speaking on behalf of the Colorado Center of Law and Policy and the Colorado Consumer Health Initiative. Thank you.
Hello, I'm Shawik Doherty, and I'm representing the consumer with this bill. 3 years ago, I found myself in a hospital, uninsured, so when I faced the bill, it was incredibly overwhelming. And now that this bill is in place, I'll be revisiting that bill. I'm still paying it off. But this is going to help a lot of uninsured individuals in Colorado pay off their bills in a reasonable, responsible way. And it's going to improve the relationship between the hospitals and the consumer. So I want to thank everyone for your support.
Great. All right. Gather around.
Actually, I'd like to invite CCHI and CCLP and CHA advocates to come forward too.
What are the chances?
Thank you, sir.